You are not going to fix your lower back pain doing exercises like the knee hugs, exercise like the child's pose, those flexion-based exercises, forward bending-based exercises, pulling your knees towards your chest-based exercises are terrible for lower back pain recovery, especially the phase you're in where you're looking around on YouTube trying to find something that's going to help you get that relief that you need, and you know you're not doing something right. Well, in this video, we're going to tell you first and foremost why those exercises are very, very bad. We're going to go through on the board to help you understand. We're going to take the L4, L5 region of the lumbar spine, but it's very similar to the L5-S1, two regions that are very, very commonly injured and commonly the cause or the site of origin of injury in lower back problems. And then we're going to tell you exactly what you do need to do to really help get this thing fixed once and for all. Some principles. It's not going to work overnight, but it is going to work if you stick at it and get some momentum. It's going to help you. Let's get into the video and really get rid of the misconception that your lower back pain is caused by a muscle. Remember, this video is an ad. If you want a plan of action that you can just follow and crack on with, then click the link underneath this video or around this video anytime and you can learn more. So is your back pain being caused by a muscle spasm? Well, chances are if it's been going on for longer than a day or so, probably not. That's not to say though that the muscles are not involved in the back problem. We have to understand that the muscles act around joints, and if we have injured joints, they react to that. Muscles don't miraculously go into spasm for no reason. They can get injured, but they don't go into spasm for no reason. And often it's that diagnosis of muscle spasm, which may of course be present, but it leads us into those exercises like the knee hugs, like the child's pose that we discussed earlier. And they just don't work because we're forgetting about the underlying cause of this problem. Now, if we take the L4, the L5 region of the lumbar spine, the muscles that run along the back of the spine here, just out of view, that aren't drawn onto the board, those muscles control and protect and brace those segments. And if we have any sort of injury here, we're going to get that reflexive muscle spasm. The problem that we have is we get caught out in this very, very annoying loop when we start doing exercises like those knee hugs, like the child's pose, flexion-based exercises that stretch the muscles out here, is that they make the underlying problem worse here whilst you're doing that stretching. These tissues are trying to heal, and we'll touch on this a little bit more in a moment. And then what happens is they get more signals sent out to the muscles to tighten back up again. So we get stuck in this vicious loop. We do our knee hugs, we feel better, but we make the problem worse. Then that sends more stimulus to the muscles to tighten back up again. So we do more knee hugs, so we make the problem worse, and we go round in a loop, never at all addressing or being having an approach to deal with the actual problem itself. And that is the fundamental issue that we face when we start taking this inappropriate approach and just diagnosing everything as a muscle spasm. Sure, there's muscle spasm there, 100% or almost 100%, but it is not the cause. It is a reaction to an injury that we're going to talk about in the next part of this video. The spine is a very strong structure. It's got a specific position it should be in. It should have a slight backward bend to it. And there are a whole host of stuff we could get into on the fact that many of us have poor posture. We spend too much time sitting, and sitting sits us in a rounded position. It stretches all these muscles out anyway. And that's a problem. But the spine is a very strong load-bearing structure. Its role is load-bearing, and it will fail in load-bearing, i.e. bending forwards, picking something up, maybe a minor load, or maybe just the repetitive stress of inappropriate, ineffective load-bearing. If I got you standing on one leg for the next 6 weeks, your leg would start to get a bit uncomfortable. We'd start to get a bit dysfunctional in that leg, and it's no different in the lower back. We spend inordinate amounts of time flexed over, rounded over the lumbar spine. It's no wonder that these discs start to get a little bit worn, because as we can see, as we bend the spine forwards, we shift our weight onto this part of the spine, the disc segment, and that can create stress and strain in a minor way that's not perceptible until that one event. Maybe we're putting the socks on in the morning and then it goes. And let's talk on here about why that happens. So we'll go through it on the board now. We take that segment here. What we've got here is we've got a nice healthy disc, a nice blue disc in the middle here. This center part is the nucleus. This is like the jam of the donut. And then we've got these ligaments that hold it in place. Those are called the annulus, or the dough of the donut, which hold the jam in place, the annulus fibrosus, and that makes up the spinal disc. On the back here, we've got the spinal nerve that's coming out. Those are those yellow bits that you might have seen on the spine a moment ago. And then we've got the back part, and this forms a little tunnel that nerve goes in. Now, you'll notice here that the spine is bending backwards. That is its neutral position before you do those knee hugs. And what invariably happens is we have compression on the front of the disc. You have to remember, if this disc bit of fluid in the middle here, it's non-compressible. So if we squash down on the front, the disc is going to drive backwards in direction, and that's where we get the disc bulge or the disc herniation or slip disc, those sorts of things. And that's going to create inflammation around here. In most cases, the inflammation is what causes the trouble, but sometimes when it's a particularly severe disc bulge, we take that injury as it breaks through these layers of the annulus fibrosis, creating inflammation, and then it goes and presses on this nerve and maybe presses it up against the wall. And that's that severe disc herniation that's hitting the nerve, and then you get the MRI report back and they go, hey, look, that disc is pressing on the nerve. But in most cases, that's not going to be the case. It might have just moved the nerve to the side a little bit here, and it's still poking out a little bit or bulging in a minor way, but there's a lot of inflammation in this space here. And as the inflammation builds up, that creates tension, it creates pressure, it creates that feeling of discomfort, that aching in the lower back, and that creates a degree of dysfunction as well in this region, which then tells these muscles to go and tighten up even more, and we get stuck in this little cycle. So what happens now when we do a knee hug or when we do a flexion-based exercise, because these muscles are tight and we're not actually considering all of this, because in most cases you don't get immediately referred for imaging. We just say, oh, it's a muscle, and this process was going on the whole time. And that is one of the things that's very concerning, because we don't know that it's a disc straight off the back. We just say, hey, yeah, sure, it's a muscle. So we're just going to stretch these out by bending this round forwards. Why do we do that? We do that to open this space out, because as this moves forwards and this vertebra tips forwards, what happens is the vertebra goes like that now, and the back part opens out. And my drawing is absolutely expert here. But what you now notice is this little space that was this big is now this big. So that inflammation has room to spread out. And now we've created more space here. But what have we also done? We've compressed on the front of these vertebrae together, and that's going to drive that disc back further. And the tissues that we're trying to heal up in the back there, they start to get stretched out even more again, and we create more inflammation. So when we stop doing the knee hug, that irritation of this segment here, of the underlying problem here that we've done from that knee hug or from that child's pose, then sends more signal back out to the muscles, and we go through that whole cycle again. Now, the reality is it's not going to move that much, but you get the picture. It is actually flexing out, and I'll show you one moment on the spine. Now, this stuff can give you things like sciatica, it can give you pain into the buttocks, it can give you pain locally in the lower back or down all the way into the lower part of the leg and the foot. But what's happening in terms of normal movement, if you look right in at one of these segments here, as we flex, you can see that the space that the nerve is in here, it actually enlarges. Okay, when we're doing that, not to the degree I've mentioned on the board here, but it does enlarge, it opens out, and that is that mechanism that we're talking about, that you're making the problem worse when we're doing those knee hugs and flexion-based exercises, period. So stop doing them now. Hopefully you understand why they are a real problem if you're trying to deal with the fundamental cause of back pain, rather than give yourself 2 or 3 minutes of relief. So we mentioned earlier on in this video that the back muscles have a role. They are there to provide stability, they're there to protect. And the core muscles in general, the muscles of the region of the spine, the trunk, are there to protect and control our spine. But there are really 3 things that you want to do to help you remedy back pain immediately, or make a start in trying to stabilize the structure. And we really want to think about stabilizing the injured site more than anything else, because the reality is we can't get in there and we can't put this lot in a cast. We can't isolate it completely, but we can learn to start to make life a little bit easier, so we stop aggravating the tissues that are trying to heal in this lumbar spine. So what are we going to do? Well, the first thing we're going to do is we're going to start to provide some stability to this lumbar spine, because if we can stabilize this lumbar spine, that is going to protect it from erroneous movement that's going to create aggravation and disrupt that healing process. That is the first port of call, learning to do that, because it's a failure to be able to do that that has quite often led to this thing in the first place. It's led to the erroneous movement and ultimate straining or injury of a segment of the spine. We've discussed L4-5 here. So we're going to learn to engage the core, and that doesn't mean doing sit-ups, that doesn't mean doing leg raises, because all of those exercises that you traditionally will run to, or pelvic tucks, are involving flexion, and we've already discussed why that's a problem. So on the screen right now, you're going to see a nice, easy core engagement exercise that just helps you engage the core set. That is the muscles that go round the entirety of the lumbar spine and hold it in place. That exercise looks really easy, but I know from experience that so many of you guys won't be able to do that, or it'll take a little bit of time. It's a bit clunky learning how to actually properly engage the core. We're not talking about the six-pack, we're talking about the deep core, the muscles that are integrally there to provide stability for your lumbar spine. And we know that 99% of you guys that are watching this video are, maybe you're in extreme back pain, maybe it's very, very bad, but you're getting on and doing things on a daily basis without having the appropriate skill to protect that lumbar spine. And that's what's led invariably to the injury in the first place, or at least played a significant role. The fact that we're not able to protect this segment and something's gone wrong. And remember, at any point while you're watching this video, you can click a link either underneath or around the video to learn a little bit more about the full program and exactly what you need to do with videos, etc., to demonstrate this in much more detail. So step number 2, we've got core engagement. What is one of the big issues with lower back pain? It's that the hips tighten up, and that's because the controlling segments, the L4-5 and the L5-S1, they control the glute muscles, the hamstrings, etc. So they're going to get reflexive tightness as well, and that is problematic. It's something we can't avoid, but they are going to be in a vicious loop. As long as the back injury is there, it's going to constantly be sending signals to those muscles. So we still want to do something, but we have to know that doing endless hamstring stretches is not the answer. It's part of the answer, but it is not going to fix it. And people sometimes get caught up doing hamstring stretches and all sorts of glute stretches, hoping the problem's going to go away. It's a part of the solution, but without building up strength, it's not going to work. And also, a lot of people do these stretches wrong. They end up bending down to touch their toes like you're seeing right now, flexing the lumbar spine, when actually, in fact, they should be doing a correct form of hamstring stretch that only involves the hamstrings themselves, and other stretches that only involve the hips moving rather than the lumbar spine moving. And that is another skill that people often lack, the ability to isolate the hips from the lumbar spine so that the hips can do all of this stuff to help make the life easier for the spine while it's recovering, and the lumbar spine isn't involved. But as you saw a moment ago, all too often that hamstring stretch involves the lower back. It's a lower back stretch. It's another flexion-based exercise that is making the problem worse. So learning how to do this thing is really, really important. Number 2, keep those hips mobile. The final part is number 3, and that is providing some relief for the local area. We said earlier in this video that the lumbar spine's role is to resist the load of gravity. It's a load-bearing structure, and it gets injured in its failure to load bear effectively. Well, what we want to do is create a bit of unloading. And you're going to see lots of exercises, even like the ones we mentioned at the start of this video, knee hugs, the child's pose, that are decompression exercises. They are not decompression exercises whatsoever. They might make this hole bigger, but they're not decompressing the lumbar spine. They are decompressing a part of the lumbar spine, and that creates issues in the process of doing that. What we want to do instead is a gentle stretch that puts the spine in its correct position, using a little towel underneath here and actually taking the load off these discs gently in their natural position, which is the position that this vertebra started out in, not the one it's in right now, where it's got a little bit of backward bending to it. And that just takes the pressure off, gives a little bit of respite for those discs in the lumbar spine, and just takes pressures off the area in general. Hopefully you found this video helpful. Those 3 practical tips, they make up what we call phase 1, which is the very first and most essential part of the Back in Shape program. Those exercises, we typically recommend you do them 2 or 3 times a day. And as soon as you are able to start doing some of the strengthening exercises, which we talk about in phase 2, you really want to be doing those and the phase 1 exercises, these 3 things that we've just discussed, going forwards for the long term. Consider them somewhat of a spine hygiene exercise. That towel that I touched on last of all, and the stretching of the lower body, are things that will keep your back healthy for the long term. They're going to reduce the amount of stress and strain that your lower back has to take in positions that it is more compromised in, by using the strong hip muscles and the stable hip joints to take bear the brunt of any loading and any movement that we're having to do with the lumbar spine, such as bending and lifting. And then you're going to have that lumbar spine decompression exercise, because we spend more time than we should sitting on a daily basis, and we use our bodies in ways which is not necessarily ideal. And having a little simple exercise that we can do, just like brushing your teeth every day, we recognize that we're putting our mouth through usage. We recognize that we're putting our spine through usage. So having a little exercise we can do on a daily basis that literally takes 3 to 5 minutes is an ideal one that you can use alongside the rehab work and the strengthening work, which is essential, which we haven't really touched on in this video as much, but we will. Again, you can click the link underneath here. But using that combination and using those little 3 things that we've discussed on this video for the long term will really help you not only get your back in shape, get this injury healed effectively, but also keep your back well for the long term. And that is what it means to be back in shape. So click a link underneath this video around here before the ad is gone, so you can learn more about the Back in Shape program and get started today with a free trial and actually get your back in shape properly this time with a plan that works.